السلام عليكم ورحمة الله وبركاته. نبتدي اليوم المحاضرة الثالثة من محاضراتنا من الصحة العامة Public Health، وهذه المحاضرة هي بخصوص Cardiovascular Diseases. What are cardiovascular diseases? Cardiovascular diseases are a group of disorders of the heart and the blood vessels which include the following. من اسمها cardiovascular. Cardio means heart. Vascular means blood vessels. So these diseases include three main categories. Coronary heart disease, which are the diseases of the blood vessels that supply the heart muscles, which is the most commonest form of cardiovascular diseases. The second type is cerebral vascular diseases. We call it sometimes stroke. It is the disease of the blood vessels that supply the brain. And also this is the next commonest type. The other type is the peripheral arterial disease, which are the diseases of the blood vessels that supply the arms and legs. Cardiovascular diseases are number one cause of death all over the world, globally. More people die annually every year from cardiovascular diseases than from any other cause. So it is considered as number one cause of death in all over the world. It is estimated that 18 million people die from cardiovascular diseases during 2016. This is the latest data about the death due to cardiovascular diseases, which represent about 31% of all global deaths. From all the deaths due to all causes, deaths due to cardiovascular diseases constitute 31% out of these all deaths. And of these deaths, 85% are due to heart attack and stroke. The first two types, as I mentioned, the first two types of the cardiovascular diseases. Now we are going to talk about coronary heart disease. Coronary heart disease is a type of heart disease which develops when the arteries of the heart cannot deliver enough oxygen-rich blood to the muscle of the heart. So when the blood, which is rich with oxygen, cannot reach the heart or any part of the muscles of the heart, this disease will develop, which is called coronary heart disease. It continues to be the main cause of deaths all over the world. Coronary heart disease is often caused by atherosclerosis. Atherosclerosis means in Arabic تصلب الشرايين. It is a waxy substance or a fatty substance developed inside the lining of large arteries, usually the large coronary arteries. So when the arteries develop these atherosclerosis, this substance will partially or totally block the blood flow in these large arteries of the heart. So when there is a block in the arteries of the heart, the blood flow will become less to the muscle of the heart. And when this happens over a long period of time, usually over many years, and it will develop slowly, the arteries will become narrower and narrower and become more hard. It becomes hardens. And then this will reduce the oxygen-rich blood flow to the heart and to the muscle of the heart. And this development of this substance inside the arteries will result in obstruction to the coronary artery, and this will result into what is called obstructive coronary artery disease. And this substance, a substance due to atherosclerosis, which develop inside these arteries, is called plaque. So the plaque will block the arteries due to atherosclerosis, which develop over a period of time or over many years. To look at this picture, we will see here, this is the coronary artery from the heart. And this is a normal artery with a patent lumen. And when atherosclerosis starts, a plaque will develop slowly. It will harden the artery, and by time it will result in a blocked artery. And you can see here the lumen will become blocked, and it becomes very narrow. So the flow of the blood, which is rich in oxygen, will become less and less. The other type of coronary heart disease is the non-obstructive type, in which damage to the inner walls of the coronary arteries will cause them to spasm. There is a damage to the wall or of the wall of the coronary arteries, and this damage make the arteries spasm. What do you mean by spasm? It will suddenly tighten, and this is called vasospasm, spasm of the arteries or blood vessels. So it is called vasospasm, and this spasm causes the artery to narrow temporarily, and when it narrows, it blocks the blood flow to the heart. So we say that we have the obstructive type, in which a plaque obstructs the flow of the blood in the artery, or in non-obstructive type, there will be a vasospasm. And if you look to this picture, this is the coronary artery of the heart, and in this picture we will see that there is no plaque inside, there is no obstruction inside the lumen, but the wall of the artery here get spasm. So we call it a vasospasm. Here in this picture, there is a 20% occlusion by plaque together with a vasospasm. And in this picture, the block is more, and there is 8% occlusion due to formation of a plaque together with vasospasm. And this is the worst type, because both types occur in this artery, and that is why we will see the lumen of the artery will become very, very narrow. So what are the manifestations of coronary heart disease? There are different manifestations, starting from stable angina. Angina means بالعربي يعني الذبحة الصدرية. Either stable or unstable angina. What do you mean by stable and unstable? The stable will become continuous, while the unstable, at times the patient feels that he is well, and in other times he feels chest pain, and that is called the unstable state of angina. Another manifestation is a myocardial infarction or heart failure. Another manifestation is arrhythmia, which means changing in the rhythm of the heart, or in the worst state, there may be sudden death. Coronary heart disease is usually caused, if we look to the causes, it's usually caused by interaction of multiple factors. So the disease causation is considered in the term of risk factors. So there is no one cause, but a relation of multiple risk factors. What do you mean by the term risk factors? عوامل الخطورة. شو نقصد بيها? They are factors associated with an increased risk of developing disease. هذا تعريف in general إلى عوامل الخطورة، من العوامل اللي تؤدي إلى increased risk of developing any disease. So the effect here of risk factors in heart disease is multiplicative rather than additive. يعني multiple risk factors acting together, which will lead later to coronary heart disease. So, a person with multiple risk factors such as smoking, diabetes, central obesity, hypertension, these are multiple risk factors. This person may have the greatest risk of developing coronary heart disease. If the person have only one risk factor, the risk will become less. If we have multiple risk factors acting together, and he will have the greatest risk of developing this disease. In general, the risk factors of coronary heart disease can be classified in two types: modifiable and non-modifiable. modifiable يعني ممكن تغييرها، ممكن تحويرها. non-modifiable لا يمكن تغييرها أو تحويرها. So what are the non-modifiable risk factors؟ يعني الإنسان لا يستطيع أن يغيرها، هي موجودة فيه. These factors include age and sex. Genetic or lifestyle factors cause the plaque to build up in arteries with age. So we see always older age group may have or may be at risk, a higher risk of developing coronary heart disease than the younger age. Why? Because of either genetic factors or lifestyle factors during their lifestyle with their age, which lead to the formation of a plaque which will build up in their arteries and they will end with coronary artery disease. So the age is a non-modifiable risk factor. What about the gender, or what we call the sex? In men, the risk for coronary heart disease, by many studies, they found that it starts to increase around the age of 45. While for women, we will see before menopause, the women have lower risk of coronary heart disease than men. But after around the age of 55, women's risk goes up. So why? Why? Before menopause, they have less risk. After menopause, they have higher risk. This is most likely because of less estrogen after menopause. So we can say that estrogen is a protective factor. Less estrogen is a risk factor. So menopause in women with age, after the age of 55 years, they have a higher risk. Evidence suggests that hormone replacement therapy will reduce this risk. I mean, if we give these menopausal women some estrogen or hormone replacement therapy, the risk of coronary heart disease will go down. Another non-modifiable risk factor is family history. Age may also contribute by causing changes in the wall of arteries. With increasing age, there will be changes in the wall of arteries. As I said, another non-modifiable risk factor is family history. So those with the family history of hyperlipidemia, high fat or high lipid in their blood, or hyperfibrinogenemia, they are at more risk of developing coronary heart disease. They are more prone to develop coronary heart disease. So age, sex, and family history are considered as non-modifiable risk factors. We cannot change them. While if we go to have a look to the modifiable risk factors, which means we can change them. We can so we can prevent the coronary heart disease. These factors include the followings. First, smoking. It's a major risk factor. There's a strong dose response relationship between number of cigarettes smoked daily and coronary heart disease. What is meant by strong dose response relationship? Dose response. I mean, if you increase the dose, the response will be higher. So the number of cigarettes smoked or the duration of which the person smoked is related directly to the development of coronary heart disease. And many studies reveal that cessation or quitting the smoking can prevent about 15 deaths and 46 non-fatal infarctions per 1,000 patient years of treatment. So that's why we call this risk factors modifiable. If we stop smoking, we can reduce the risk of developing coronary heart disease. Another modifiable risk factor is hypertension. The incidence of coronary heart disease increases with a rise in blood pressure. So any person with hypertension should have drugs for this so that it can reduce the risk of developing coronary heart disease due to a continuous rise in his blood pressure. Another non-modifiable risk factor is hypercholesterolemia, increase or higher cholesterol in the blood. There is positive correlation between plasma cholesterol and morbidity and mortality or deaths from coronary heart disease. Especially when the plasma cholesterol is more than 220 per deciliter. So coronary heart diseases are directly related to low density lipoprotein. And if you know from your previous lectures in other studies, the lipid has many types, including cholesterol, and the cholesterol is of two types, high density level and low density level. The high density level is considered as a protective type of cholesterol, while the low density level is regarded as the most worst type of cholesterol. So when the low density level increases, this will directly relate it to coronary heart disease, while high density lipoprotein has a protective effect, and it should be more than 30 milligram per deciliter. Cholesterol HDL ratio can be used to predict the risk of coronary heart disease. We can measure the cholesterol, measure high density lipoprotein, and we find the ratio. If it is less than 3.5, a ratio of less than 3.5 is the clinical goal for coronary heart disease prevention. We should prevent coronary heart disease. It is the goal for this prevention. Another non-modifiable risk factor is physical activity. Regular exercises increase the high density lipoprotein or this type of cholesterol and also reduce blood pressure. So physical activity is an important factor to prevent the occurrence of coronary heart disease. While in other terms, the physical inactivity will lead to coronary heart disease. وهذه اللي نسميها bad lifestyle والخمول وعدم الحركة will increase the risk of coronary heart disease. Fifth factor is the obesity. It's mainly the central obesity is an independent risk factor of coronary heart disease. When the waist circumference is more than 102 centimeters for males and more than 88 centimeters for females, or where the waist to hip ratio is more than 1, this indicates risk association. So the central obesity, it is the waist obesity and the waist to hip ratio. And this is a factor, a risk factor, which may lead to coronary heart disease, but it is a modifiable one. Another modifiable risk factor is alcohol. High alcohol intake of 75 grams or more per day, and especially if it is daily, is an independent risk factor also. Dietary factors. Diet deficient in fresh fruit, vegetables, and polyunsaturated fatty acids will lead to or may be considered as risk factor to coronary heart disease. Decreased level of vitamin C, vitamin E, and other antioxidants are implicated here also. Number 8 of non-modifiable factor is the mental stress. Stress can aggravate the symptoms of established heart disease. And many studies have shown that type A personality people are more prone to coronary heart disease. Those people who live with more stress. See this diagram. What is the difference between type A and type B personalities? Type A personality is a competitive person, time urgent, hostile, and aggressive. And he's always in stress. In contrast to type B person, who is always relaxed, who is patient, who is easygoing. فإذا الفرق ما بين type A و type B personality. type A personality يعيش دائما بسترس، بينما type B يكون دائما relaxed و patient. فإذا type A الناس اللي يتصفون ب type A personality are more prone to develop coronary heart disease. Another factor is the use of oral contraceptives. Women on oral contraceptives have higher blood pressure, may have as a side effect, and if those women are also smokers, they will be also at a very high risk of coronary heart disease. So those factors are considered as modifiable risk factors. If we can change these factors, we can prevent the occurrence of coronary heart disease. So we are going to talk in summary about the signs and symptoms of this disease. بالحقيقة احنا ما نحكي clinically على الأعراض. This will be talked in other lectures, and we are mainly concerned with the prevention and control. But in summary, we can give a hint about some signs and symptoms of coronary heart disease. So, an acute coronary heart event, such as a heart attack, it may cause the following symptoms. First, angina. Angina, in this here, the person can feel something like pressure, squeezing, burning, or tightness of the chest, mainly during physical activity or during walking. This pain or discomfort usually starts behind the sternum, but it can also occur in the arms, mainly on the left arm, or on the shoulders, on the left shoulder, maybe in the jaw or throat, maybe on the back. sometimes the pain may feel like indigestion. So any of this symptom, if somebody got this symptom, especially during his physical activity or during walking, he should consult his doctor. Other symptoms include cold sweats, dizziness, lightheadedness, nausea or feeling of indigestion, neck pain, shortness of breath, especially with activity, as we said, sleep disturbances, and weakness. So this is in summary about the main signs and symptoms. Now we are concerned mainly in public health with the prevention and control. Usually, as we said in the first lecture, when we apply prevention, we should apply the 4 levels of prevention. So if we apply first the primordial prevention الابتدائي مثل ما ذكرت بالمحاضرة الأولى. This involves prevention of the spread of coronary heart disease risk factors and the lifestyles that have not yet appeared in the population. So prevent the development of the risk factors of coronary heart disease during childhood where they have not yet appeared. إذا احنا ذكرنا بأنه لازم أكو risk factors حتى يحصل coronary heart disease. فإن this level of prevention نمنع حصول risk factors in the population through good and healthy lifestyles. We should follow healthy eating habits, healthy lifestyles like regular exercises, and they are considered as essential steps. Ideally, this should be started in early childhood because most of the risk factors start very early in childhood and grow by years. So we should prevent their occurrence from the childhood by adopting healthy lifestyles, healthy eating habits, exercise, prevent smoking, prevent alcohol, prevent high-fat diet, prevent sedentary life, encourage more exercises and regular exercises. In this level, health education is very important strategy. How we can prevent this? How we can encourage healthy lifestyle? Through health education that should be enrolled in the school curriculum and during the childhood stage. The level of prevention here needs also national policies and programs on healthy food and nutrition. إذا نحتاج سياسات وطنية، نحتاج إلى برامج حتى نحدد what is healthy food, what is healthy nutrition. We need policies to discourage smoking. نحتاج سياسات مو فقط في health education. For example, to discourage or to prevent or to quit the smoking in public places or in some places in which there is overcrowding. We need programs to prevent hypertension. We need programs to promote regular physical activities. So it's not only health education, but we need policies from the governments. We need programs so that we can apply this type of prevention or this level of prevention. The second level of prevention is primary prevention. Primary prevention, as we said, it includes health promotion and health protection. Health promotion, تعزيز الصحة, involve first dietary changes, includes cessation of smoking and alcohol, cessation of smoking and alcohol. It involves regular exercise, involve avoidance of stress, and to get enough sleep. And the recommended amount of hours for adults is about 7 to 9 hours per day. So these strategies will lead, or they include all in health promotion. Specific protection in this level include the use of polyunsaturated fatty acids. This is a protection. Limiting fat intake to 30% of daily caloric requirement. Specific protection include the use of polyunsaturated fatty acids and to limit fat intake to 30% of the daily caloric requirement. Principles of dietary modification include, first, to reduce fat intake to 20 to 30% of the total energy intake. Second, to reduce the saturated fat consumption to less than 10% of the total energy intake. To have a fiber-rich diet, which includes cereals, fruits, whole grains, and legumes. To avoid alcohol, reduction of salt to 5 grams daily or less. These are some principles of dietary modification so that we can apply health promotion and health protection. The third level of prevention include, or what is called secondary prevention. And the secondary prevention, as I said in the first lecture, it includes early diagnosis and early treatments so that we can stop the progress of disease and prevent complications. So early diagnosis include high risk screening. The people who are at high risk of developing the disease should be screened, and also routine periodic investigations for persons with family history. Any person with family history of coronary heart disease should have routine periodic investigations so that we can know the risk factors. Third, we can do what is called stress test. نسميها الجهد، اختبار الجهد وتخطيط الجهد وإيكو الجهد أيضا. To check how the heart works during physical stress and to identify early cases which show normal routine ECG. What I mean, if somebody have some ECG and it shows normal, we should do also stress test for him so that we can identify during this stress or during the exercise, we can identify and diagnose very early cases. So during the stress testing, there should be a walk or there should be a run on a treadmill or stationary bike to make the heart work hard and beat fast. وهذا أيضا تخطيط الجهد اللي يكون على بايسكل أو على ركض أو على آلة اللي تسرع بالمشي أو الركض so that we can make the heart work more hard and beat very fast. In this case, if there is any change, we will show these changes on the ECG during this stress test so we can diagnose very early these factors. Also on the second level of prevention, we said early diagnosis and early treatment as well. So what is the medical treatment? It includes the treatment of other risk factors. It includes the treatment of hypertension, treatment of diabetes, and the main drugs which is used in the case of coronary heart disease include nitrates, هذه الحبوب اللي تحت اللسان عند الحاجة. beta blockers, angiotensin converting enzyme inhibitors, statins. الستاتينز هي الأدوية اللي تمنع تراكم الدهون. And this is some medical treatment so we can stop the progress of disease and stop the complications. About surgical treatment, there is many types of surgery, including coronary artery bypass or balloon angioplasty. And in this case, a small balloon-like device is threaded through an artery, so it can open the blockage of the artery. And see this picture here, when there is a plague here, and the lumen is very narrow, so we can put this type of device, and there's a balloon inside, and in this case we just blow the balloon, and then we can take, either it will stay in there or we take it out, and this is what is called the stent. شبكة نسميها الشبكة, the stent. And this will make the walls of the artery separated, and it will remove the blockage. The fourth type or level of prevention is called the tertiary prevention. التأهيل, المستوى الأخير أو الثالثي. We mean if we reach to, in the cases of complications and even the treatment will do nothing, here still we can prevent at this stage by doing rehabilitations. So we can limit the disability through balloon angioplasty, and we can do rehabilitation. And the rehabilitation may include physical, occupational, and psychological rehabilitation. تأهيل جسدي, تأهيل مهني, تأهيل نفسي also, and this will give physiotherapy, for example, and this will give the patient some relief from the complications. So we talked about coronary heart disease. Another type of the cerebral vascular diseases, another type of this vascular diseases are the cerebral vascular diseases. So here the term stroke is applied. And here either there's acute severe manifestation of the cerebral vascular disease, which is called stroke, or it may be chronic type. The clinical manifestations here in the brain, in which there is less blood flow to the brain, here, clinical manifestations either subarachnoid hemorrhage, or cerebral hemorrhage, or cerebral thrombosis, or there may be occlusion of the pre-cerebral arteries, or there is the last one, transient cerebral ischemia, which is more than 24 hours. transient يعني لفترة قصيرة جدا تكون قلة الأكسجين إلى الدماغ، فنسميها transient cerebral ischemia. The most dangerous form is the stroke, where there is acute severe manifestation. In this case نسميها cerebral vascular accident, CVA. نسميها CVA, cerebral vascular accident, ونسميها أيضا stroke. The extent of the problem: nearly 75% of stroke patients have also associated cardiovascular diseases, or they may have diabetes. Incidence ranges from 0.2 to 2.5 per thousand population. 0.2 إلى 2.5 per thousand population. It is a leading cause of death or mortality, and 1/3 of stroke patients die within 3 weeks. 1/3 of patients with stroke or with acute manifestation may die within 3 weeks, and 48%, nearly half of them, die within 1 year if it is acute. The mortality shows declining trend now in developed countries, and the reason is a reduction in the risk factors for this disease. Here also the risk factors include non-modifiable and modifiable risk factors. The non-modifiable risk factors include age. It is more in higher ages or increases with age. The gender, it is more in males. Race, it's more in African and Asian than European people. And heredity also, there's a positive family history that is associated with this disease also. ولهذا سميناهم non-modifiable لأنهم ما نقدر نغيرهم. The age, the gender, the race, and the family history. While the modifiable risk factors of stroke include the following: hypertension, heart disease, diabetes, hyperlipidemia or hypercholesterolemia, smoking, excess alcohol, polycythemia, and oral contraceptives. These are called the modifiable risk factors. The most important behavioral risk factors, we call them behavioral. What do you mean by behavioral risk factors? It means due to the behavior of the people or the population. The most important, these behavioral risk factors of heart disease and stroke are unhealthy diet, physical inactivity, tobacco use, and harmful use of alcohol. Those are risk factors, modifiable risk factors. وفي نفس الوقت نسميهم behavioral because it is due to the behavior of the person itself. The effect of behavioral risk factors may show up in individuals as raised blood pressure. يعني في حال وجود هذه behavioral risk factors راح تبين على شكل hypertension or raised blood pressure, raised blood glucose أو diabetes, raised blood lipids اللي هي الهايبركوليستيريميا, and overweight and obesity. إذا في وجود هذه behavioral risk factors الإفكت أو الريزلت راح تكون عندهم هذه increase أو raise in all blood pressure, blood glucose, blood lipids, overweight, and obesity. And this is the end actually of this lecture, and you are going to have a rest, and thank you very much.